as we wrap up today, kind of I wanted to take a couple of minutes with Walter and and discuss some of the remaining barriers. So if we could pull up the slide where I talk about we're talking about specifically to focus on one topic, the VR for treatment of pain. There is, as we've demonstrated today, quite a mountain of evidence supporting the use case for pain, and there are others too, for phobias, for PTSD, but we've chosen to tackle pain through most of the conference today. And there are still barriers. Even though we are at Hoag deploying it wide scale, there are still barriers before it can be deployed wide scale across the nation and to make it available to every hospital system and every patient. So, I wanted to talk through some of these, Walter, with you to kind of see if if some of these are being solved. For example, the first one, infection prevention, this is an issue where is an issue in the hospital setting. So if we're deploying it in the hospital or clinic settings, the headsets are passed from one patient to another. In the home setting, treating it at home, it's of course not an issue because you'd have your own headset. But in the hospital setting, this is actually one hurdle which I put up here, but actually, in my opinion, has been solved by Cleanbox Technologies. Can you talk a little bit about that, Walter, and how that's helping to to allow deployment in hospital systems?
Well, you're absolutely right, Rob. The need to be sure of cleanliness is paramount, and it's really, I think, been effectively addressed by the technology that Cleanbox has brought forward. The idea of being able to place our devices, and not just the HMDs, but the controllers and other things that we touch and use as part of our research and clinical care, and effectively use ultraviolet and other mechanisms to sterilize them. It makes all the difference. Otherwise, I know we'd be very uncomfortable using something that was not personalized and taken away by the patient. So I do think that's been effectively addressed, although I think not everyone has one. So it's there's still a process of getting them out and use, but I think there's a pathway. But there's a few other items on your list, and I have a few more to add to the list too. I think they're all surmountable, but we do have hurdles, and that gives us some projects to work on together.
Yeah. Why don't you pick, which one of these things you think, these topics we've got, the issue of protected health information, EHR compatibility.
Well, I think that, well, let's talk about EHR compatibility. I think it's broader than EHR per se, although that's a great way to start. Right now, there's so many groups moving from different sectors into develop these very powerful systems. Some of the groups that are working in this arena emerge from the academic arena, maybe over in computer science, or maybe in engineering, or maybe in the medical sector. Other groups are emerging from the startup arena, and some of them are coming from the business arena. But very, very few people have been in the field for long enough, and the field is emerging so fast that there's a big problem with nomenclature. There's a big issue in terms of how do we, as we collect much more rich data about behavior and about cognition, we need to come up with new metrics, and we need to find ways to harmonize and standardize the measurements that we're doing, so that a study that's done at Hoag can be compared to a study that's done at Cedars-Sinai, and that can be compared to a study that's done at Mass General. We need to effectively come up with, I don't want to use the word standard per se, but I do think we need to come up with a way to harmonize some of the protocols, some of the measurements that we take, so that we can do comparisons. I think the other issue that we're grappling with right now, and I think this conference has gone a long way to address it, is there's a perception that VR technology is a gaming technology. It's used for entertainment. So I think there's I'm sure that many of the people who have been part of this meeting have had the experience of bringing a VR system for a patient to use, and having them react by thinking, well, this is just a game. And it's so much more profound than that. And I think that's something that meetings like this, but also more outreach, can help change perception. And of course, we need to do a lot. And that's what you've listed as physician awareness, patient awareness. I think that's so key. I would also add to the list that we really need to bring to the surface some of the validation that has been done. There's been a lot of research that has been done behind the scenes for this. But many of the people who are seeing the technology for the first time don't appreciate that. So I think there needs to be more awareness given of the power of the technology and how solid the research has been to validate it.
I totally agree, Walter. I mean, and this kind of goes on to our next point of, because there is, an enormous amount of evidence basis behind a lot of this stuff, I mean, as I pointed out in my talk, for pain, level 1A evidence demonstrating its efficacy in decreasing, patients' sensation of pain, improving their pain control, for pain neuroscience education. I mean, that's as big as it gets in medicine, level 1A evidence, and that kind of, goes to the next point of FDA clearance. We are working as part of with Paula and you and myself and Bob Fine and several others to try to get towards this. And what the main message that I'm trying to deliver, as a physician, we have neuroscientists, we have physicians, we have patients. The main message is that we're comparing a treatment which is known to work with very little risk to the alternative is opiates, which are known to work for a while and then they progressively don't work, or you require more of them to work, and there's significant negative side effects. So where I'm hoping to get, as far as the FDA, and I know we're working together on this, is to this idea that this is an unmet clinical need, that there is a real need for, to make a dent in the opiate crisis. The $650 billion that are spent on treatments for chronic pain, the 50,000 Americans that we lose every year to opioid overdoses, 80% of which, so 40,000 of them started with medications that were prescribed by their physician for pain. And now, them dying in huge numbers. We have to get the message through to the stakeholders at the FDA and at the CMS that, that this is an unmet clinical need and that we have digital therapeutics which can at least help solve this problem.
Well, I think in a way we're part of it is a nomenclature problem. I think I'm looking forward to when we don't say digital medicine or digital therapeutics, that it's just medicine and therapeutics. And there has been an onrush, and some things that aren't really well designed and are pretty lame, and it's sometimes hard to sort through it. But not all digital apps need to go through FDA approval. And many of the development groups are that I think could come up with really fantastic interventions, and many of the clinicians that are poised to adopt some very powerful interventions are sort of paralyzed by this concept that of FDA review. Now, there are some things that certainly, things that we swallow, things that go into the body, things that are making diagnostic decisions must be accurate and they must be safe. And we need to know that. But there also are things that we know are effective and can be moved forward. And it sort of turns a little bit also on the reimbursement side of things. And I don't think it'd be worth calling out the insurance carrier that is moving forward with supporting VR applications and not waiting for FDA review to say, yes, this is effective and we'll cover payment for it. But there are groups out there that are saying, let's do this. Let's move it forward. Let's establish the business model. But to be honest with you, I think it's also incumbent upon us, the people at this meeting and elsewhere, to show the business ergonomics of what we're doing. I think we do have to show the efficacy and, check on the safety, of course. But I also think we need to show the business ergonomics. We need to demonstrate that it doesn't chew up extra time, that it does unnecessarily, and that there's value in bringing these products in that justify the modest incremental cost and the fact that you have something else going on into the clinical process. I think the value is there, but we need to also show not just the healthcare improvements that occur, but the business improvements that can occur by using this very powerful technology.
Yes, and that's a great point to finish with, Walter, because that's actually why we've had so much success doing this here at Hoag, because we started off by demonstrating not just the clinical benefits, but also the financial impact that this can have, because it's improving outcomes, and when you get better outcomes, care is more cost effective, and it drives continued investment in these strategies, in these digital solutions at Hoag, as well as at many other institutions. I know at Stanford as well. There's a lot of investment in this space because the scientists and the physicians believe and have proven that it works. And so when something works to deliver better outcomes with lower risk to the patient, eventually the economics work themselves out.
Yeah, but we need to put appropriate attention into collecting that information as much as we're collecting information about effectiveness and safety. And again, one of the other things that's on your list right now is protected health information. I think that is such a key thing. And as we rush forward with new technology, that has to be a foundational concern.
I agree. And fortunately, that's one of the things that, the cybersecurity people have gotten really good at locking those things down and protecting them. I mean, if you look at it, like anything can be hacked, right? Including the CIA and FBI databases get hacked, like in the Department of State, they get hacked. So there is security measures that can be taken and are taken as they are with EMRs. But, that's one of the things where I think that there's almost, in some cases, too much emphasis on that because, we have our applications on our phone, which have our banking information, which are readily accessible. But there's a scare that if somebody could get into my phone, they might find out I have high blood pressure. Like, I'm less worried about that as a physician, and for my patients, I'd rather actually there be more open dialogue, because in some cases, the concerns about protected health information gets a little bit, with HIPAA, gets a little bit in the weeds, and it actually in some cases prevents clinicians from communicating with each other clearly. So I think that a due, respect and consideration needs to be given to that, but I don't think it needs to be, the Fort Knox of the digital world.
Yeah, one thing we have to keep in mind is things are changing very rapidly. Healthcare will not be the same 5 years from now as it is now. We're seeing the tech titans jump in. We're seeing groups, so Apple and Google and HP and all, Facebook and Oculus. They're all jumping in. And we're also seeing groups like Walmart and Amazon becoming players in the healthcare delivery system. It's going to change things quite a bit. And I think we do have to keep some fundamental guiding stars as to what's important. But I also think we have to be good defense is an offense. I think we have to help shape it. And that's, I think, one of the values of a meeting like this, is that we can together get, organize and come up with our first principles and work together to shape this tidal wave of change that's on the way.
Yeah, it is coming, and it's already started to come this year in 2020. I mean, we saw the rapid pivot to even Zoom or telemedicine based visits, and some of that is here to stay, and for the betterment of the patients. And I think the next wave of that, beyond simple two-way conversation, will be to employ some of these advanced remote monitoring capabilities and some therapeutic capabilities beyond just dialogue.
Well, it's very exciting.
Yeah, I think that's kind of all we have for today. I wanted to thank you, Walter, particularly for being such a guiding light for us, here at Hoag. Your counsel and your advice and your friendship has been invaluable to us as we grow the program here, and we hope to reach more and more patients.
Well, thank you, Rob, and I think Hoag is one of the key centers of gravity for this, and is really making some very important things happen. So thank you, and to the rest of the Hoag team for putting this together. It's very important.
Yeah, we take immense pride in what we're doing here at Hoag, and in the care we provide. As a quaternary level referral center that is not academic, our main focus is on advanced patient care delivery and really providing to each individual patient an excellent level of care, and again, caring for the patients as if they were our own family. And with that, I would like to give a special thanks to our production team here, Andrea Pastori and Nicole Nguyen, who made this conference happen and have been working night and day to make it a success. The entire team at Hoag, and on behalf of our President and CEO, Robert Braithwaite, thank you for tuning in today to Hoag Advances in Medical Virtual Reality, and we look forward to seeing you next year for our next edition. Thank you.